down? Can you turn that down? This is the library. I'm trying to study.
If you have a problem, you can go somewhere else. I want to listen to my music.
What's going on? This is your 4th speeding ticket.
Mom, I told you already. The police, they were just looking for a reason to give me a ticket. It's not my fault. Bye, police. Leave me alone. God, they're so annoying.
Where are you coming from? What happened?
The police arrested me because they thought I was stealing, but I wasn't.
What did you steal?
Like I said, I wasn't stealing anything. My friend said I could have the shoes, so I took them.
No, that's considered stealing. That's like 3 months ago when Sarah said you could borrow the necklace and the police were called.
I was going to give Sarah back the necklace, but I forgot.
Do you even feel bad that you got in trouble?
No, I don't feel bad for it. I think I'm old enough to make my own decisions.
I think you have a problem. You have a disregard for others. You're deceitful and manipulative. We need to get you help before you turn 18 and you actually get arrested.
Hi, my name's Mara. I'm going to be your nurse today. Can you tell me what brings you to the hospital?
I think there's something wrong with my daughter. She feels no remorse for anything she does. She's impulsive and she steals.
Okay, can you tell me what Jericho was like as a child?
She used to wet the bed, sleepwalk, throw rocks at animals. In her early teens, she got involved with smoking and drinking. I always thought this behavior was because my husband and I's divorced, but it's been persistent over time.
Jericho, what are your thoughts on what your mother is telling me?
Nurse, let me tell you, it's my parents' fault. All they did was argue. Then eventually they got a divorce, and no one else is going to take care of me, so I do what I want. I don't understand why I'm here. I get good grades, and I'm a good student.
What can we do? Are there any medications to help treat this?
From the information I've gathered so far, I believe that medication therapy might not be the best option for this. I think behavioral therapy would be best for Jericho. The client's name is Jericho Rodriguez. She is 17 years old, and her mother has brought her here today because she's been acting impulsively. The client has a history of substance abuse and stealing. The client also denies that she has a problem and she thinks that everything is fine.
It seems that the client has a personality disorder. The DSM-4 TR lists personality disorders as a separate category from major mental illnesses. All major mental illnesses fall into Axis 1. However, personality disorders fall into Axis 2. Judging by what you have told me, I would diagnose this patient with antisocial personality disorder.
I just spoke with the doctor, and we understand that these problems that your daughter is facing are associated with a disorder called antisocial personality disorder.
Well, what does this mean? How can we make her better?
Antisocial personality disorder is characterized by a pervasive pattern of disregard for and violation of the rights of others, and with central characteristics of deceit and manipulation. Some of my goals with my treatment include that she'll demonstrate non-destructive ways to express her feelings and frustrations. She should also identify ways to meet her own needs that do not infringe on the rights of others. And lastly, she will achieve or maintain satisfactory role performance in school and in relationships.
That sounds great. I would love for my daughter to take responsibility of her own actions. How do we go about doing this?
First, we need Jericho's compliance. Jericho, does this treatment sound okay with you?
I honestly don't think I have a problem, but if it means everyone will get off my back, I will definitely go along with this.
When it comes to promoting responsible behavior, we will start with limit setting. We will state the limit and then identify the consequence of exceeding the limit, and then identify the expected behavior. Jericho, can you give me an example of this?
Okay, I guess speeding is an example. The limit would be speeding. The consequence of this is getting a ticket, and the acceptable behavior would be obeying the speed limit.
Yes, that's a good example. We would also promote consistent adherence to rules in a treatment plan. Ms. Rodriguez, it's important that you confront Jericho when it's needed with regards to her behavior. You would go about this by pointing out the problem behavior, then keeping Jericho focused on herself and her actions. We will also be helping Jerica solve her problems and control her emotions through effective problem solving, decreased impulsivity, expressing negative emotions, and also taking time out for stressful situations. Lastly, we'll enhance Jerica's role performance. We will do this by identifying the barriers to role fulfillment and eliminating the use of drugs and alcohol.
Thank you.
Thank you for your help.